low, comp, and detailed, and this is new or established?
This is established if it's a follow-up.
Yeah, he's a
Okay.
follow-up.
So 9,
So we know it's not 202,
Yeah,
we know it's not
we don't get
215, so it's between 213 and 214.
214. Okay.
Mm.
So does everyone understand why I chose that code?
2 out of 3.
Case studies. I have to read more about this because I'm very confused.
Detail, comprehensive. I got
Okay.
C, that is 15. I got the letter C because it has the comprehensive, it has the,
Okay, but when you look at 99214, I'm sorry, when you look at 99215,
Comprehensive, and high complexity.
yeah.
yeah.
So you would, it doesn't fill the 5 because this would have to go to comprehensive or MDM would have to come up to high.
One or the other would have to be up there. Because you need 2 out of 3.
History and exam,
So, well,
detail and comprehensive.
the history was detailed, the exam was comprehensive, and the MDM was low.
Low.
So
The 14.
to do the 215, we'd have to either bump this to comprehensive or this to high.
So it's the 14 because it's a detailed history and a detailed examination.
Mm-hmm.
Hey, I got it!
Yes.
Finally I understand.
Yeah.
Finally! Oh my
When it
god!
happens, it happens. You just had your moment.
Finally!
The light just came on.
Yeah.
I'm so happy because I think that was the reason that I lost the exam. Oh my god, I understand.
Okay. So, and this is how these problems are going to be set up on this exam. Linda and I used to do audits. So Linda is used to seeing the entire note and grading it and coming up with these levels. I think, so she has to move.
Completely turn around.
Yeah, you have to ignore everything you know and just take this and plug it in. If you, when you just take this and plug it in and say, ignore what the note says, use what they tell me it is, and code that. And now, I mean, you should be able to do these like that.
Well, I don't remember everything, so that's the
Well, obviously neither do I. I've made several mistakes already. Okay, but does everyone understand how we got there? Is everybody comfortable with that?
I think that now I understand. I want to do more exercises, but
Well, there's several things you have to remember. For a new patient, any new patient, you have to have all 3 elements. Okay, so when you're looking at all 3 elements, and so therefore it is the lowest one that determines the code. For an established patient, you only need 2 out of 3. So you drop the lowest one, and it's the other 2 that determine what your level is. That's it. That's it. That's it in a nutshell. For any new patient, and that means all patients in the ER, and any first time, and here's another trick question they put in there. Patient was seen by someone else in the practice within 3 years. Not by you, but someone else in the practice. Is that a new patient or an established patient?
More than 2 years in your patient, right?
More
More
than
than 3.
Ah, the 3
years.
3 years in your patient.
So if the
Yes.
patient was never seen by anybody in your practice, that's a new patient. If the patient was seen by someone in your
It's
practice,
okay, it's not.
access, it doesn't even have to be in the same office. Remember, 170 offices billing under the same tin. Not a new patient.
Oh,
Unless
okay.
Unless they're an affiliate.
No, no. Unless Lorenzo is internal
A different specialist.
internal
So
medicine
if internal
Adriana
medicine
is a
or
cardiologist.
GI or, yeah,
Oh, okay.
Yeah.
so, yeah, I didn't specify, and that is the other piece.
That's for new pay, okay.
Yeah.
Yeah. So, Adriana, what we're talking about is Lorenzo's
A
our
PCP.
PCP. You're our cardiologist.
You're both in
Ernesto
access.
is our pulmonologist.
You're all in access. You're all billing under the same tent.
So you're all in the same group. He's the PCP. He's got me as a patient, and he's like,
Poor thing.
yeah, you're gonna be working hard. So he sends me to you because I've got some undiagnosed chest pain that he can't figure out. But he just saw me last week. But because you're a cardiologist, it's a new patient. You come up and you say, okay, Jeff has
Atrial fib.
AFib. AFib, but I also notice he's breathing hard and he's wheezing a lot. So I'm going to call Lorenzo, and then you two agreed to send me to Ernesto,
Who's a pulmonologist.
who's a pulmonologist. I'm a new patient again because he's another specialty.
Ah, okay. That's good.
But-
They work for us.
But
That's-
if Lorenzo decides she doesn't want to deal with the cost of this patient and has him transfer to Benson, it's not a new patient.
Yeah. Yeah, because Benson is
Yeah.
PCP.
Yes.
Okay.
How does it work with family practice and internal med? They're different, right?
Yeah, and,
So you gotta know if your PCP is family practice or internal med.
and so they won't, for our billing if you were working in our coding department and coding fee for service, you really have to know the specialties and the subspecialties of internal med versus family practice versus geriatric versus, a cardiologist versus a cardiac surgeon, and who's who. For this exam, they're not going to be, they're just going to make sure you understand the rule. So they'll be more obvious about it, but it's the 3-year time period, and it's the same subspecialization. So that's what defines the new. My father.
And I will tell you, when you're in the offices and you're looking at notes, you will find a lot of mistakes that way. That they thought it was a new patient and it wasn't.
My
Yeah,
father.
that is when they put an established patient in the basic.
Yes, if you're ever out there doing an E&M audit, which you won't be, you're all MRA. But if we ever get nuts and make you do the other thing.
My father didn't see his cardiologist for 4 years, and he got his bill, and he asked me,
Why am I a new patient?
why am I a new patient? And I explained to him. I said, after 3 years, you went back to the same person.
Right.
It's a 3-year rule.
New and exciting.
So that's the whole new patient spiel. Okay. So what do we have next?
They have a nursing home, we have Traveler and a Spelunker, we have a caver.
Yeah. So yeah, I was a little bored when I wrote these questions. We have a nursing home follow-up and EPF history, detailed exam, and MDM was high. So MDM,
It's a follow-up, so there's that's a clue.
okay. So this comes down to EPF.
Subsequent. Expanded problem focus history and a detailed exam. MDM was fine.
So
Can I ask something?
Okay, is you're looking for a new patient, the questions, right? So you're looking for all three elements, and there's a low MDM, or
Okay,
just in order to get
For what? For
okay,
an-
so,
New
low
patient.
For a new patient, all three
Three.
elements.
Right.
right,
So the lowest one is the one that's gonna be your level, cause you have to
oh, the
have all
lowest one.
three,
Okay. Oh, okay.
right?
Yeah.
Cause the
Okay.
lowest one can't
Is
be,
it right?
okay, so that's gonna determine.
Oh,
For an
Established.
established patient, you
Mhm.
only need 2 out of 3, so you drop the lowest one.
Oh,
So
okay.
then it becomes the lowest of the other 2.
Right. Oh, okay. Now
so,
got
just an example
thank you.
of this. So you're my, so how I met Lorenzo, my PCP, is I had a hangnail. He did a complete, no, Lorenzo here.
Oh, this Lorenzo, okay.
Okay.
So Lorenzo, it's Lázaro, it's okay.
Lázaro.
Lázaro. Is it Lorenzo?
That's why
Lazaro.
I'm thinking Lorenzo, she,
Jesus.
Lazaro.
Lazaro, okay. Lazaro, and.
Is it
no, and
Lazaro or
It's like in the
Lazaro?
Bible, Lazarus.
Lazarus.
Yeah.
Oh,
Lazaro.
goodness.
Like the
Okay.
people, yeah, it's not any
And
that.
so, until then, nobody corrected
Can't
me.
get rid of him, he'll be back. We'll just call you retread.
So I think last class and this class, nobody corrected me on this. So Lazaro.
Right.
Okay, so I go, the way he met me as my PCP is I went in for a hangnail. He did a comprehensive history, a comprehensive exam, but it's a hangnail. He just, and we were done. The MDM was straightforward.
That's true.
So when you're, this is how you kind of think about setting that, is that, okay, so you had comprehensive, but it was so low here on a new patient in his office, 99201.
You got it the lower.
Because, well, ignore this graph, but,
Yes,
but yeah, it went with the low one because you have, with that, you have to fill all 3. And it was a hangnail. It was the absolute straightforward decision making. Even though you took a whole family history, my social history, my past medical history, you did we'll use the 95 guidelines, you did 8 system review, and then you pulled the hangnail. So all you can charge for was the lowest level service. Even though you did all that other workup.
Okay. Thank you.
That's a way to help you remember that. So this was done in a skilled nursing facility, a SNF. And I just threw this in there because they will toss in other locations other than office. So I wanted to toss one in there. But once you locate where it is, the fact that it's a nursing facility,
That drops off to the code.
okay, that helps drop off the codes, but also you should realize that the process is exactly the same. Okay, we have an established patient. These are our 2 highest. It fills both of these to here. 99309 if I'm remembering correctly when I did it.
Yes.
Okay, so you see how the process was the same? You just located where it was, a nursing facility visit, because it was a SNF. And then you recognize the fact that it's an established patient. So now you're looking at the 2 out of 3. So the whole process is the same. Locate where they are,
Still work for you?
Yes,
Okay.
now yes.
locate where they are, new or established,
Right.
or initial and subsequent, and then apply this.
Okay.
So, if this were a new patient, what would matter? The history.
That one, the
The
history.
history.
Yeah!
That's it. That's it.
The history. Un paciente nuevo. ¿Verdad?
You know what? This is the best way to teach
There's
this.
siempre el mismo
This is the
history,
best.
va-
I've never seen this. This is the best way
No,
of teaching.
this is how I think of it, this is the way I teach
La
it.
historia.
Porque el código
Best
es
way
más
of
bajito.
teaching it.
Sí, es nuevo.
God brings back Jenny.
Oh,
Oh, hi,
Ese paciente
Jenny.
es nuevo.
yeah,
Tiene esas mismas flechas. El código lo vas a escoger, es donde esté.
You know, she
la
still
lista
calls
en
me.
bajita.
I have
Sí, es un
certain
paciente
phone
nuevo,
numbers in
el
as
código que
Jenny's
tiene
name.
las flechas.
So when somebody calls me,
Oh.
her name comes up and it's
Ahí
always,
viene
it
el
always is
código,
a,
entonces, el
oh.
nombre es el código.
yeah,
I have a
El
moment.
más alto, más
He
el
needs to
código
change
está
that.
abajo. Si no ve
I'll
4
leave
o
it.
9 por ahí.
Aquí está. El estudio dice aquí está.
Okay, the next one was a trick question. So, the doctor violates HIPAA, first of all, because he writes back to someone, we don't know if they're a doctor or not, and says, thank you so-and-so for referring this patient to me. And then you can tell he rendered his opinion, he did because you're given the exam, the history, and the MDM. And so you've got a report, you have a referral, an opinion, and a report. The problem is, oh shoot, I forgot okay, you have to have, for the first part of
a consult.
a consult is a request from a physician
So you don't know.
or a legal body. A judge can request a consult, an insurance company can request a consult, but it must come from someone like that. If I refer Ernesto to Adriana, because she's a good physician and I want Ernesto to have good care, then
Man, this is Barbara.
just
Yeah, answer.
No, Barbara?
is it Barbara?
Hello? Hello? No, she's not here today. All right, bye-bye.
So
Diana.
Diana.
She's looking
Deanna.
for Diana.
We don't have a Deanna.
She's not
And it's
here.
Saturday, so.
So if I refer my friend Ernesto to Adriana because I want Ernesto to have the same good care from Adriana that I do, okay, she can't charge him a consult because I'm not a doctor. It was just a referral. You have to have a request for a consult. And then the person that the request was sent to has to render an opinion and return a report. Without those elements, you do not have a consult. So when this one starts out violating HIPAA and returning a report to someone for a referral, that's not a consult. So the 9924 series codes that are in there get tossed immediately.
Okay, and it's a new patient, so
Mm-hmm.
He is a new patient.
new patient, so we're going with the lowest
The
of the
lowest is
three.
A. The answer is the A.
Just one.
No, the
That one is
answer is C.
442 and 449203.
He is a new
Oh,
patient.
it's C, yeah.
It's, yeah,
Because it's
it's,
99003.
Yeah.
It's C.
New patient, that's not a consult, so it's it's 203.
Mhm. The lowest.
But here say no new or established patient consultation.
right, but remember.
But it's
But
not
you
a
look-
consult, he just went through why it's not a consult. So under D, you don't know whether that's a doctor or not.
Because we don't know that.
Right,
He just went
We
through
don't
that.
know if Sandra D is a doctor.
so,
So
If
it's
say
different from-
Dr. Sandra D
Then
is a
it's, yes,
consultation.
yes.
Wait.
Okay.
For new patient.
Dr. Sandra.
Will they be that, will they do that on the test? They'll
Yeah.
do that?
I can do that.
But will they do that? But will they?
Yes. So, but, the language also would have to change if Dr. Sandra D just referred the patient. It's still not a consult.
There has to be 3 elements.
Dr. Sandra D has to request the consultation of the doctor. So
So would have to say, thank you for requesting this consult. This is, yeah, so you would have to have, you'd have to identify the requester as a doctor and the request as being a consult.
Okay.
and not just a referral. So when Lazaro sends the patient to you, he can send it either as a referral for you to treat my cardiac issues, or he can send it, he can say, I request a consult and send me to see you for one time, and then later on make a decision to send me back for
So
cardiac.
I need the word consultation.
Yes, a request for
A
consultation.
consult or consultation. I
Yeah.
need the word to work with this.
And identifying that the requester is
It was a
either
doctor.
an attorney or another physician.
Yeah,
An attorney too.
yeah.
Yeah.
Okay.
If someone in the legal system
Okay.
or the insurance companies request a consult, they can request a consult, and a physician can request a consult. No one else can.
Lower. Call.
Consultation by doctor
Or the insurance company.
consultation.
So in other words, if I send my father to Dr. Nimmer, if I send my father to Dr. Nimmer, it's not a consult.
But it's a referral?
It's a referral.
Or
Is it a
referral.
referral?
But a referral is just an office visit,
Okay.
just a new patient.
But if I get Dr. Singh to write the order,
Yeah,
then it's
That
a
is a
consult.
consultation.
Yes.
yes. Singh can request a consult.
Yeah. Okay.
Okay. And so Dr. Freud was appreciative, I guess. So we have Dr. James McCoy ordered an MRI of James Kirk's left radius with and without contrast.
D for
Okay, so let me.
is 732.
Why didn't he just use his Feinberger device?
732A is magnetic resonance imaging upper extremity other than down without contrast. 19
What do you do
is
with and
with
without?
contrast material.
Right, but 20,
The 20.
Is both.
But say further sequence. The 20 say with contrast material follow, but contrast material and further sequence. We don't know in the question if the patient going to need more.
That's right.
That is not mean the future sequence. I don't know.
it doesn't, I don't believe it requires more. It's just saying if you do more sequences with and without. So if you do one with and one without, it falls to that code. Any further sequences, you don't get more codes. You see what I'm saying?
So why is B
But-
not right?
So the right is B? No, the right is because the B doesn't have 26 and it's the Dr. James who ordered them, yeah?
Okay, well,
But that's the professional component, is it not? Or is it the
but what I'm
technical?
saying is C is the correct one.
Yeah, I see.
Yeah, I'm asking why B is not.
Okay. Okay, because C, B, you've unbundled them. You said he wanted.
Oh, okay, alright, it's bundled, okay, I see it.
And,
That's the
and-
word.
And I'll go into bundling in a little bit. But when you have a code that has both with and without, that holds them both. And we're going to talk about NCCI in a few minutes once we get done with this, and I'll discuss what bundling is. But just like if this were missing, if there were something other than and further sequences on there, because it's just talking about with and without contrast. So they can sequence that as many times as they want, and it's still the 73220. When they sequence it once, it goes to that code. So, what you,
No, no, I'm sorry.
it's okay.
It's Barbara.
Do you understand? Let's get to unbundling, and it'll make it more clear.
For example, what means further sequences? That means that the patient going to need, probably he going to need more exams, more tests, right?
Yeah, more tests.
Probably, we don't know.
Yeah,
But
With and
here, no.
It's further sequences, more sequences.
Further sequences. That means that he needs
More without contrast and more.
más examen el otro día,
More, but the same thing.
but in a different
So
day.
the
or
same
probably-
test, different date.
hang on.
It's the same test and different day. That is my question. That means further sequences.
It's just, it would be the same day. They were
Same day?
same day, but I'm trying to.
One copy.
There's a word.
On the same service.
I think it's only one copy.
Okay, I can't.
Because I,
Without contrast.
So, what 73218 represents is if he sent him up only for the test without contrast,
Yeah.
and then he sent him up 73219 is if they sent only for without contrast. So when he sends for with and without,
Yeah.
that's the 73220.
73220. Yes.
Okay. So that's where I got C from.
Yes, but my question is, say unfurther sequence. What that mean?
Okay. See, I don't know. This is where my lack of knowledge of medicine would come. Is that I don't know how, like, I don't know if it's even possible to do without, then with, then without again.
I'm not on the
No,
same
no,
day.
no, no,
no. Okay.
Not on the same
No.
day, because you won't clear it.
Not the
Right.
same day.
And that's what I was thinking. But this would be for the combined code, and the last part I don't understand either, because based on that it doesn't make any sense.
Because I understand that you say if we have a code that had both with and without, we can use. I understand that. But the two word further sequences to me is like you're going to need more tests in a different date. And the question don't mention nothing around that one.
Yeah, and
It's actually the bundled versus the unbundled. It may be a bad question, but what he was going after was bundled versus unbundled.
Okay. So the
And
thing is, if we had a question with a test, with contrast and without contrast, we get the option that has both in one.
yes.
Okay, Yeah. Not two codes, just one code that had both ones.
Yeah, you always choose,
No
the
separation, just one.
right, always choose the most comprehensive code.
Okay, okay.
It kind of goes back to the lab thing with the panels. If it doesn't meet it, you go down to the next one. That's why the panel explodes on you.
And here we don't use the 26 because they don't ask for the the professional component.
Right, it says he ordered it, so someone else is doing it. Okay, the next question,
I'm sorry.
okay. The next question is for MRA, septicemia, and,
The D.
yeah. Okay.
This way, I see it, right?
Yeah, this is just strictly ICD-9.
Yeah, listen,
I didn't mix this-
MRSA.
Estafilococcus.
MRSA.
Mercy.
MRSA.
Yeah, MRSA.
Right.
Not to be confused with Mirza.
No.
Yeah, but we won't make that joke. And the next one was, let's see, diabetic gangrene, yes.
There's 256 because it's muscular,
Yeah.
and PVD.
No,
So, but it's
really.
not, but it's diabetic. It's gangrene. So it's just one. It's just gangrene.
It's
With
the-
the diabetes.
C.
it's C. It-
57 into okay. Yeah.
Because you need
Because it's due to the gangrene is due to
It's-
diabetes. Yeah. Right.
it's diabetic gangrene. So
Right.
the gangrene is due to the diabetes.
Right.
So you have to have both codes.
Right. It's like
Yeah.
CKD due to diabetes. It is.
785 is gangrene.
Sí, porque es diabetes, no que es por diabetes.
7854 is
So
gangrene,
gangrene.
but it's do diabetes, so it's
Right, you have to
Ah.
use diabetes code.
That's good.
Yeah.
And this one is circulatory something. I don't know.
It's a PVD, but it's only
That
about,
is
there's
PVD.
It's
no,
not a baby.
it's there, it's PVD.
it's just
Mhm.
PVD, so it's gangrene.
Yeah.
Yeah, that is specified
I don't
gangrene.
remember those codes.
Let's see. Okay, and then pneumonia due to E. coli is, oh wait, malignant tumor
Malignant tumor.
of the internal cheek. Yeah, let's see it again.
See, the 12. The 13 is pneumonia due to E. coli.
E.
E.
coli.
coli.
E. coli.
Escherichia
E. coli.
coli. Escherichia coli.
Okay. And that one, I gave you a bunch of answers to make it confusing. There is actually one combination code for it, and when you have a single combination code,